Hello, I am Celia Falikov. I'm a clinical professor at the University of California in San Diego, and I'm pleased to be here with you today to let you know about an article that is being published in Family Process that I co-author with Drs. Ora Nakash and Dr. Margarita Alegria. It is titled Centering the Voice of Low-Income Clients in Collaborative Practice. This article examines how practitioners can facilitate in-session collaboration while they interact with their clients. We conducted an intensive analysis of 4 exemplar transcripts of psychotherapy sessions by therapists working in mental health centers with low-income clients. The cases were selected from a much larger study on training therapists on shared decision-making skills. Shared decision-making is an approach used in behavioral health care primarily. It recognizes that clients are the experts of their own lives, and therapists need to make the client's agenda the center of therapy. We examined the transcripts using collaborative and critical approaches in family therapy, as well as including the concepts that were being taught in shared decision-making. We found that therapist communications that center clients' voices could be grouped into 5 practices. These are arriving at a shared agenda for the session, being mindful of a balanced amount of talk so that everybody's voices could be included, being tentative and presenting ideas or recommendations, collaborative meaning making, and the last one is co-constructing behavioral tasks. In our intensive analysis of the transcripts, we could also observe when therapists decenter, muffle, or even silence the voice of clients. So we're able to make recommendations about what types of clinical practices to avoid. This study can be helpful to family therapists and to all mental health professionals, really, that are interested and committed to collaborative practices. We also pay close attention to the power differentials that are inevitable in any therapeutic encounter, but that may be even more pronounced in conversations where the clients don't feel entitled or feel inhibited to question the voice of the therapist. Our analysis suggests that collaborative and critical approaches in family therapy could profit from shared decision-making strategies. Couple and family therapy tends to include, inevitably, conversations that involve competing agendas. We believe that consistently arriving to a common agenda for the session may be the first step towards family collaboration. The 5 categories of in-session practices, communicative practices, are thoroughly illustrated in the paper with verbatim transcripts. So that could be very useful for training therapists in collaborative and critical approaches, as well as in shared decision-making. Although the case studies are drawn from a sample with low-income clients, we believe that the practices that we describe can also be very useful for clients of different socioeconomic levels. So thank you very much for listening. If you have any questions or want to make any comments, either about what I said or about the article itself, please don't hesitate to email us at the email that appears in the last slide. So thank you very much for listening.